What? Child. Anyway, so
welcome back to Stay Composed with Black. Is that a flow? In today's video, we are going to explore an interesting question. Why do we squat differently? You might have realized that not everybody squats the same. Some people have a narrow stance, others have a wide one. Some people are able to reach the parallel while others are struggling to. Is it because of a technique? Or is it because you are carrying a heavy weight? Let's find out together. The way we squat is influenced by a variety of factors, including the structure of our hips. Today, we are going to focus on two aspects of hip structure that affect how we squat: the hip rotation and the depth of the hip socket. Let's dive in and understand how these anatomical differences shape our squatting patterns. So let us first look at the hip rotation. We have internal rotation and excessive external rotation. They both refer to the movement and positioning of our hips, particularly the femur, which is also known as the thigh bone, during a squat. Both can impact your form, depth, and the muscles being activated. Internal rotation occurs when the femur, the thigh bone, rotates inwards, causing the knees to point more towards each other. And then when we look at the excessive external rotation, I feel like I fall under the excessive external rotation when it comes to the hip rotation. So basically it is if your hips can't rotate inwards much but can rotate outward a lot. Your squat stance might naturally be wider and your toes might point more outward. While we are in the hip rotation, let us now turn our attention to the hip joint angle. So the angled hip joints, they determine the range of motion, depth, and stance that best suits an individual. So if your hip joints are angled more to the side, you might squat with your legs wider apart to feel comfortable and maintain balance. And then if we look at the depth of the hip sockets, so a deeper socket means there is more bony coverage around the joints. This causes a bony limitation to movement. If your hip sockets are deep, it might be harder to squat deeply because your thigh bone, femur, hits the edge of the socket sooner. Shallow sockets can allow for deeper squats. So shallow sockets with less bony coverage will achieve a greater range of motion. These differences in hip structure affect how deep you can squat, how wide your stance is, and the angle of your feet. There are other anatomical variations like femur length. People with longer femur relative to their torso may find it hard to squat deeply without leaning forward. There's also like a spine shape, and the C-shaped curve on the neck can also be one of the anatomical variations, but we are not in a biology class, so we are not going to go deeper in that. Flexibility and mobility plays a huge role in how we squat. Limited dorsiflexion in the ankle can prevent deep squatting and may cause the heels to lift off the ground. Tight hip flexors and hamstrings can restrict the depth and proper form. You need to warm up and stretch before you attempt to squat. Other factors that may affect how we squat can be the form and technique. Training experience and technique can vary widely, affecting how efficiently and safely one squats. These factors contribute to the wide variety of forms or squatting forms that is observed around different people. So before you judge a person's form or technique, first educate yourself and remember to stay composed. Until next time, goodbye.